September Health and Wellbeing Board meeting, and we have a few things we should go through right at the beginning of these meetings. The first one being can we please make sure people's phones are switched to silent to make sure they don't interrupt the meeting. If people do wish to ask any questions or enter the debate, could you please signal by using the hand mechanism. Sometimes we get a delay in the Wi-Fi as such, so we don't want to overtalk anyone. So if we could just sort of stick to those sort of basic principles that we've agreed on a number of things in the past. If that's okay, I'd like to welcome everyone to the meeting. At our last meeting, we did say that we'd hold this one as a catch-up, knowing it was going to be middle of probably in the middle of a COVID situation, and we are. So I'm pleased that everyone's managed to come along today. So my phone machine stopped beeping at me. And so if we go to the first item on the agenda, so sorry. Yes, I'd like to thank everyone for coming along. I know everyone's got busy times, but I think we've done a lot of good work over the last few months, and we need to make sure we keep that going. We've also got some very good reports on the agenda today, and when we go through them, I think you'll see the scope and range of work that the council and health partners and everyone else is actually doing collectively to make sure we not just get through COVID, but we have a long-term outcome around a whole range of issues. So if we move to the first item on the agenda, which is petitions, I haven't received any notice of petitions. Do we have any attendance by reserved members? I couldn't see Janet on the meeting. Is Janet there?
She's here. Yeah, she's here.
Oh, I was wondering if councillors could keep their cameras on, then we can sort of make sure if anything comes up later on. So if we now move on to declarations of interest. So some of them have already been published online. Does anyone else have a declaration of interest they wish to make to this meeting today? There's no hands gone up. Or is any declarations from any other members present? No. If we move to minutes of the last meeting, can we just agree that they're a true record of the meeting? Yes, excellent. So that moves us on to question number 5, which is public questions. We actually do have a public question, and I think that is from, is it Andrew? Andrew, you are there. So yeah, I see you there, looking on different screens. If you want to read out the question, and then we'll answer that question, then you get a chance for a supplementary question.
Okay, so the question is relates to children's mental health and emotional well-being, and in particular the difficulty I personally have experienced trying to get support from the local authority to support a solution that we have been working on as a charity. So we've created, and to give a little bit of background here, we've created a solution, quite an innovative solution, to support the mental health and well-being of children, which engages parents, carers, elders and professionals. It's been through a continuous process of improvement over its years in the making, and we've been trying to get help and support, but after speaking to various people in the local authority, we've eventually been told that there's no funding from the council and the council is unable to promote it. We've been working on this for years already. Okay, since 2014.
Sorry, Andrew, could you just read the question on this time? Because most of the narrative behind the question has been published online. So if you read it out, and then we can answer the question.
Perfect. Okay, sorry, I wasn't sure about that. So the question is, what else do we need to do for the local authority to review this piece of work, which, as I said, has been 5 years in the making, with a view to supporting children and families within the various council statutory services?
Christine, did you want?
Yeah, thank you, Chair. Thank you for your question, Andrew. I'm answering it as the portfolio holder for children and young people services and education in Harrow. So I'm glad you know that, because you might have thought, why have I suddenly popped up? So thank you for your question. I mean, you must be aware that mental health and well-being are two of the most important areas of the work that we do in the local authority and in the health service locally. And there has been, of course, a special different focus since the lockdown, the first lockdown began in March. And as a local authority, we have a role in helping to establish locally, nationally recognised programmes, and we have encouraged local schools to make use of them. However, we also, as you will understand, review programmes put forward by private companies, and so the local authority's procurement is a carefully balanced process, given the requirements that we have, given the resources that we have, and given our capacity to review. Now, we've got strong working partnerships, and I'm sure you also know this, with Harrow schools, with the voluntary sector, and also with the local health service, both via GPs, but also through the mental health provider for children and young people, which is CNWL. And there is very strong co-production which has been established, and in my own previous experience, before, when I had a proper job before doing this, actually the local cooperation between partners, I think, has become exemplary. It's been building over the years and is doing very well. So our aim is to obtain programs which are evidence-based and which can be and will be carefully evaluated. And a very important part of our co-production is the involvement of young people, children, but also young people as users of services. And we review and reflect with them. And in fact, with one of our co-productions, we actually were able to involve young people in the design of the service. So given what we have, this is what we do. And I could give you a very long and detailed list of all the different programs which are in process or are even planned in Harrow, because despite the lockdown, we have got 2 new projects which are going forward. One being because of a bid that we put in for government money, and also because of a bid that was put in by CNWL for money. But perhaps rather than just do that, I could just tell you some of the people who are involved. So obviously CNWL through CAMS and also through commissioning extra services. That's the Harrow Horizons project is one version of that, but there's a new one. Mind in Harrow, our own early support service, Wellbeing for Education, which is in schools and also has extra educational psychology support, and then also the Harrow Young Foundation, Public Health, both commissioning and providing, schools themselves, and parents and schools working together. So there is a long list, Andrew, and you probably are very familiar with all of that. But given that we have all of this provision, I think that what we're doing at the moment, I'm quite proud of. So do you have a supplementary question?
Yes, I do.
Actually, forgive me, I don't know. Chair, did you wish to add some more to my response?
No, I think you've covered all the areas so far. Andrew, did you have a supplementary question to ask?
Yes, please. So I understand those resources. I've been speaking to various people within the council, and I've been provided a list like that. And I think it's fantastic. I honestly do. I've been working in this area for 5 years. I've worked with adult mental health. I've looked at the issues within the society, if you like, and the one I think where this all spawns from, for me, so that you understand my perspective and the intention of which was behind this 5 years ago, is that I could see quite obviously the problems that were being replicated in society was a disconnection between the elderly and the youth. Mm-hmm. My charity has been working with the elderly for the last 5 years, and actually we've done some very good work at our leisure centre, in care homes. Unfortunately, it's all come to a halt at the beginning of the lockdown, but that's one of the main purposes of our project, is to try and establish that connection again. Okay, so all of those projects are fantastic, but very few of the projects that you currently have engage parents as well. It's great to educate children. It's fantastic to educate teachers. And it's great to put all this stuff out there. But actually, the best way that you can do this, and Anna Freud will tell you this as well, and in fact, they have it on their video on their website. You can have a look at it. That the best way to do this is to educate the parents and the children together, because actually that family unit is the piece that we really want to fix in order to support them going forwards. And I know that you understand that. So
Andrew, could you actually ask the question?
Yes,
please?
I will, but I'm responding as well. So this project that we've been working on, we have spent 5 years on it. I know that you've been working on mental health for quite a few years as well, and I commend the work that you've been doing, but there isn't anything like this. That's why it's taken so long. So we need someone to assess it. We need someone to look at the benefits of it and the impact of it. We have plenty of information online. We have a report that I sent to yourself, Mr. Henson, and the other leaders of the council, Mr. Hewitt, Mr. Tollick, everybody, Jovina as well. And the response from that has not been, I think, adequate. Especially if we consider we're doing a lot for mental health now, but it's not basing that on what we've done in the past is not an accurate representation of what we need for the future. Okay, we can't do enough. There is no health without mental health. So the question is, what can the council do to help support evaluating this piece of work, this resource, because its intention is greater than the individual resources that you're putting out there? That's my question. Still stands. What can you do to help? I know that you're doing a lot, but my question is that.
Thank you, Andrew. The difficulty being, of course, that this pertains very particularly to you and to the work that you are doing, and so this body is not really the one to answer that question. You've had an answer, which is we are doing what we can with the resources that we have. My advice to you, coming from my previous experience as a clinician working with children and young people over 40 years, would be that you need to get some independent evaluation. Perhaps since you're interested in Anna Freud, you might be able to approach them, and that might help you in your mission going forward. And just to let you know, I'm not disparaging what you're doing at all. And all my work in life has been, you don't just work with children. I mean, you start with the parents. You start with prenatal if necessary, but also to let you know that the Scout movement, several years ago, were running a project which must have come very close to your heart, which was children, Scouts actually, going into care homes. And I did, and I remember commending that. So I don't think that this is the body to take forward what you're asking for, but my suggestion to you would be that you go and get some independent evaluation, which might make you feel better. So I don't know, Leader, whether you would wish to add more to my response?
No, we can't, because the local authority does not get, as you said right at the beginning, we don't get involved in promoting private companies in themselves or reviewing their materials. It's done through the professionally supported programs. I think which you went through in your answer, Christine.
Yeah, I understand that, but one of the requisites of the criteria of this board, as well as the leaders of the council, is to promote innovation. We're not asking to make a profit out of doing this. We're asking for
Andrew,
to.
The purpose of the board is, yes, promoting a number of things, but it's within the guidelines and remits that we have in place. So we can only do it within what is laid out to us, which is professionally supported programs, which we do through the schools and through other health partners that we have in place. Because otherwise we would be inundated with a number of different individual companies coming to approach us, and we wouldn't have the capacity to.
Absolutely, I understand that completely. But one last thing I will say is that I have been in the council.
I've got to move on with the meeting. You got one more, well, very quickly.
Okay, I just wanted to say that I actually have been working with the council, speaking to different people in public health, in the Department for Education, been filtered down through Public Health England to Andrea Lagos and Carol Twirlong's team. And I've been, in the last 2 years, been bounced around in the council. And I've seen this problem grow. So that's the reason I'm pushing it, and that's the reason I'm here.
Okay, thank you very much.
Okay. Thank you for your responses.
Thank you for asking the question.
I just have one quick point, and then I think Janet's got her hand up. Is that a point of order, Janet? Or is it just because your hand was up?
Sorry. The shadow portfolio holder, and I endorse what Christine says. But what I wanted to say was one thing that we are doing, which is very innovative in the schools. We've got a mental health practitioner pilot in schools, and it's going to go from the 30th of November to November 2021, and that is really good. It's working with children in schools in a pilot situation of 8 schools, primary and high schools, incorporating staff, parents and the young people themselves. And it's as we're firm believers that to help children cope with mental issues when they're younger, it helps prevent serious mental health problems when they get older. So
well, thank you, Christine. Sorry, Janet, we seem to have lost you there, Janet. But anyway, I think we got the point. We need, if we want to,
I've got a note.
Yes,
so it's very important that we address issues with young people, and then hopefully when they get older, they won't have the bigger issues with mental health. So it's very, very important when they're young as well for these mental health practitioners. And again, they're going to be working in schools, parents and the young people to work to a happy future for them all. Thank you.
Chair, if I might just say, thank you, Janet, for that. I was holding back on providing all the information because I would have taken up even more of the meeting. But thank you very much for that and for your support. Thank you.
Yes, it's not a debating item really, but because we've got the other items on the agenda to deal with that. I forgot. Sorry, we had received apologies from Simon Crawford because of issues work he's got within the hospital. So if we now move on to deputations, we've had none received. We now move on to item 7, which is the COVID-19 update. As you would note from the agenda, a lot of these are not our normal reports, they're done as presentations, and to make it easier to go through, they've been published, so most people should have read them before coming to the meeting. So on this one, can I invite, is it Javina and Ayo?
No, I think this is Carol, the first one, Graham.
Oh, sorry, yeah, sorry,
COVID,
Carol.
yeah.
Yeah, sorry, cheers, yeah. So can we invite Carol and Angela, please, to move this particular?
Hi, I'm Carol Furlong. I'm Director of Public Health in Harrow, and I'm just trying to load the presentation, which is hopefully here. So I'm going to do a quick update. I've actually updated the slides since they were published, so that you've got the most up-to-date information. So our dashboard at the moment is showing that we have 192.7 cases per 100,000. Which is a little bit of a decrease on previous days. And if you look over at the trend graph, it looks like it's flat, which is good news. We're over 2 weeks into the lockdown, and we predicted that it would increase because of the impact pre-lockdown. Takes a little while to work through, and we were predicting that in the last few days we would start to see a plateauing, and then hopefully we'll start to see it going down. We're coming from quite a high level, so there's quite a long way to go down. In older people, then the number of cases has also decreased over the past couple of days, which is also good news. Our testing rate is quite high, and our positivity rate is also quite high. We would like to get testing up a bit more, and I'll come on to that in a little while. And our test and trace is currently remains at 80%. It went down last week to 79%, or the week before last, sorry, to 79%. And since we've taken over doing local contact tracing, we've got it back up to 80, and we're hoping that we'll make further improvements on that as we go along. That's the cumulative data, so it is quite difficult to make a big impact on that. So as I said, you know, these are the number of cases that we've had in the last few days, and our 7-day moving average, which is still very high. I've put some more information in, and I've expanded the slides because I was told that people couldn't see the previous one. The next 3 slides just go into a bit more detail about the patterns of COVID that we're seeing. So you can see from this one that the darker the colour, the more infections we've got. So the highest proportion are in the 16 to 29-year-olds. It's actually in the 20 to 24 within that 16 to 19-year-olds is the highest rate in Harrow. The rates in the 30 to 40-year-olds, and particularly in the 45 to 64-year-olds, is going up, and the rate in older people has gone up, and hopefully it's starting to come down again. The rate in children over the last few days, the last couple of weeks, the last few days has gone up, and some of that is because with lockdown, households are getting infected and passing it on to the children. So it's not necessarily that they're picking it up in school. We still don't think that we've got any school spread, particularly in the younger children. We'll move on to the next one. In terms of geography, we have no geographical pattern at all. It changes from day to day and week to week. If we have a single household, a large household that all have COVID, it makes a difference in the ward level data. So we are looking to see whether we can make any more of this data. We're looking particularly at areas that have got low rates of COVID, because we don't know whether that's low rates because they're not having tests, or low rates because they've got a true low rate of COVID. If it's because they're not having tests, then we need to do more work in getting people tested in those areas. And in terms of ethnicity, over the last couple of days, we've seen an increase in the number of cases in the Asian Indian population. So that's gone up by a couple of percent compared to last week. It's still broadly similar to the ethnic breakdown of Harrow, but that group is now slightly overrepresented. We did have a change in data. People may have seen something about this with university students being allocated to their borough of where their home residence is, rather than the borough where they're at university. And this just shows you the impact that had over a couple of weeks. That's now been amended, and it took our total COVID cases down by 140 cases, but the actual trend in recent days hasn't actually changed, because it's not really made much difference there. And obviously, you know, when we're looking at more people, more older people particularly, getting COVID, we're seeing more people going in hospital. And the hospital has seen a big increase in the number of people being admitted, and that will ultimately result in us increasing the number of deaths in June, July, August and September, we had occasional deaths from COVID spread sometimes weeks apart. In October, we had at least one death every week, and that's continuing through November. So just a word on testing. We have a local testing site opened in South Harrow on the 9th of November, and we have really good capacity there. It's been well utilised, but we've increased the capacity so that we can see more people, and more people are going. We've got mobile testing units at the Civic Centre. They come twice a week to Civic Centre, and they go once a week to Northwick Park. And we're developing a second local testing site and scoping out a third local testing site within the borough. Testing in care homes is taking place, and although there's a few delays in getting the results back, which we've fed up back to the DHSC leads, and we're really pleased that yesterday's announcement that domiciliary care staff will also be able to avail themselves of weekly testing, as well as visitors to care homes, which we're absolutely delighted about, because that's one of the areas that we've been lobbying to try and get testing, so that people in care homes are not socially isolated. And in the coming weeks, you'll have all seen in the newspapers about rapid testing at scale, or mass testing, as newspapers like to call it, and that will be for asymptomatic people in we're going to try and target that. With the government announcements yesterday, we're changing our plan slightly, because one of our target groups was domiciliary care workers, and another was visitors to care homes. So we are looking further at what we can do, and we're trying to target schools so that we can test all the teachers, to give parents more confidence in sending their children to school, and also supporting the schools in maintaining the children actually in school, rather than having to teach remotely. And there's also another rapid testing that's being expanded into the NHS as well. We've done lots on promoting awareness with different communities. I've listed a few of them, and we've done various meetings to do some myth busting and to tell people what COVID's all about, and try and get the messages out to people, because some of the information that we have from surveys is that people still don't understand the messaging. They may be digitally excluded, or excluded because they're not getting information in their right language. So we've been working with some of our communities to produce videos, and we've got some multilingual information as well. Some that's been developed Pan London, working with Doctors of the World programme, and that's in, I think, 64 languages now. And then we're also, because of that increase in the young adults, we're working with Westminster University and the Young Harrow Foundation to develop some videos targeting sort of Christmas messages. We did a Halloween video which went down very well. On contact tracing, we have 80% of the people have been contacted through the NHS test and trace data, and we're aiming to increase that through our local team. We started just a week and a half ago, and we have public health members, so most of my team are doing calls, environmental health professionals, and also staff from the community contact centre. And we will try and contact everybody within 24 hours of us receiving the information that they need contacting. Try and contact them twice in that 24 hours. If we're still unsuccessful, we do check that if we've got any other contact details for them, so that we can try and make contact with people. we then send emails, and we will, if we haven't got an email address, we will actually take letters around to their personal addresses, asking them to contact us. And we're looking at whether or not we would need to roll that out. But I think with some of the plans that are coming online around testing people, so that people can have more of a normal life with if they're identified as a contact. So the idea is with the new rapid testing, that we may be able to test people for every day for a certain number of days, and if the test is negative, then they can go about their normal life, and if it's positive, then that's when they start to isolate for 10 days, or that's when they get a PCR test, and then if that's positive, they will isolate. And so, you know, we're looking at this. Everything's constantly moving, as you can appreciate. Just a word on the COVID support grants. We have business grants for businesses that are impacted, and there's personal isolation payments if people are asked to isolate, and both of those there's information on the council website. And then a final slide from me, which is just about the vaccination programme. The delivery of this is being led by the NHS, and sites have been identified, and we're waiting for confirmation of 4 sites that we're expecting to be approved within the next week. And we're expecting, or fingers crossed, we're hoping that we will have vaccine by mid-December. Not likely to be huge quantities of it, but enough to start the programme. And the programme's been targeted at the highest risk groups first, so care home residents, care home staff, NHS staff who are doing aerosol generating procedures, and then people living in the community who are over 80, and then over 70, and then over 60, and so on, and also the clinically extremely vulnerable groups. We do need to do lots of communication on this with our NHS partners to make sure that people are informed about the vaccine programme, and that we address some of the misinformation about that's currently being promoted. And I'm now going to pass on to Angela to talk about the Adult Social Care Winter Plan.
Thank you, Carol. So this is for assurance to the board regarding the Adult Social Care Winter Plan for 2021. So the Department of Health and Social Care published their National Adult Social Care Winter Plan in September 2020, and it sets out the expectations from the local authority and our partners in NHS and care providers. And every local authority is expected to have a winter plan in place and ensure that it's published, and has contingencies to ensure that the local delivery of care in Harrow in this case is in place through the challenges of winter, and particularly now obviously with COVID this year. So we, as I said, we have completed our plan in Harrow. We work very closely with our partner agencies, our colleagues in the CCG, and we're in regular contact with all our providers several times a week actually. Carol, would it be possible to do the next slide, please? Thank you. So the plan, as you'll see, ensures that the contingencies are in place to make sure. So you'd have heard things talking about our recovery plan as a whole with all our partners in the care system. So that covers seasonal flu, health and care services, joint working, supporting people who receive social care and their carers, and that's obviously in care homes as well as in the community, supporting the care workforce, which has been absolutely critical. Social care extends way beyond adult social care, social workers, so that's our care workforce in our care homes, domiciliary care, personal budgets, and making sure that the care market funding and provider stability is there, particularly in this year. And there is local and regional and national oversight and support. So as I said, the plan is shared, it's published, It's continually reviewed and it's updated. And I suppose this is just reassurance for the board that we have done that. Thank you. I don't think I probably need to go on to that slide. I think I've covered it. Thank you, Carol.
Thank you very much. I'm just moving my screen down to match everyone else's. Is there any questions on the report? There's a lot of information there, and I think most of it people are aware of anyway, all the way through. Gazantha.
Thank you, Chair. Just a question, Carol, thank you very much for your update. The question is the higher infection rate in Indian community. Is particular reason because of recent festivities, or they are not following any guidelines? Thank you.
Yeah, it's always very difficult to say exactly why the rates are going up in any one community. If people were not following the guidelines during the recent festivities, then that possibly could be a reason. It could just be that we've got a number of households that have got a lot of people in them. You know, it's very difficult to say. We can't pinpoint one particular reason. As I said, you know, across the whole borough, the numbers are fluctuating, and we because we're testing more people, you know, we're expecting to find more cases. So it's difficult to pinpoint one reason. But you know, we're trying to encourage people to follow the hands, face, space mantra and make sure that we minimise household risk mixing, regardless of whether we're in lockdown or not. You know, household mixing is not a good idea because you can pass the disease on quite easily when you're indoors.
Thank you, Carol. There's no other questions, so can we, the recommendation is that we note the report. Could we note the report? I see Javina has a hand up. Javina, did you, because we got quite, this information has been available through, and we got some very long reports coming up. So Javina, did you have a question to ask there?
Thank you, Chair. It wasn't a question, it was just a comment. I just wanted to thank Carol and the public health team for all of the work that they have been doing recently. We've been having a plethora of information come through, which has really been timely and really supportive and being discussed at the Health and Care Executive every Friday. And it does really make quite a difference when you have, you know, real-time information. So I just wanted to acknowledge the work and thank colleagues for all of the efforts. Is hugely appreciated. Thank you.
Thanks, Javina.
Yes, thank you, Javina. It's an important point because, you know, that's the partnership is what's kept us getting through COVID as we've gone through, and there is a lot of information, although we've all seen it, but it is a lot of effort to put all this information in one report. So can we note the report, please? Agreed. Can we move on to item 8, which is progress on the integrated care system for North West London? And I think that's the one Javina's.
I think Genevieve is going to present the first bit, Graham, and then Javina.
Genevieve. Can't see Genevieve. Are you there, Genevieve?
She is. I'm just going to check. She's just frozen. She might be having an internet issue. If you just bear with me 1 second, please.
Camera for. Yeah, I've come off vision. So does that help?
It does, Genevieve. Thank you.
Should I load the? Are you struggling there, Genevieve?
Okay, well, I think I'll start while we're waiting for Genevieve to come on. Thank you, Ayo. So can we go to the next slide, please, Ayo? So if you just keep going to the first slide with the so just setting some background while Genevieve is joining us. Ayo, can you just move on to the to slide number? Yeah,
Hi, Javina, can you see it now? I am moving
yes,
it, but I'm not
yes,
sure
that's
it's coming
fine.
up. Okay, thank you. Thank you.
Yeah, okay. So what Genevieve is going to really take us through is a quick summary of where we are in terms of the single developments that are taking place for Northwest London. So as everybody's aware, and we've talked about at the board earlier, that we're developing all areas in England are expected to develop into ICSs, and for London we will have 5 ICSs, with Northwest London being one of them. We are working towards this journey with a discussion and a restructure about moving from 8 sovereign CCGs into one single CCG, where we're trying to move away from that commissioner provider split. We've been doing all of that. We have made members and colleagues aware that we have been in a restructure process, which is just about coming to an end. And with that in mind, each borough is going to be part of the single CCG team. So there's going to be a health and care partnership where each area will have its own CCG team. It's a borough-based team. But however, we have got some shared senior posts. So we have one single uniform, single management team across Northwest London, which is comprising of 3 chief operating officer posts and 3 director posts, which are responsible for out of hospital, also known as local care, primary care, and what was the third one? Hospital care and hospital care. Along with this, we have a director of comms, and we have a partnership director, and we have some other ICS posts, and this will form the leadership for the ICS moving forward. So can we go on to the next slide, please?
Javina, do you want me to take this slide now?
Oh, thank you.
Okay, thank you. Thank you for that. I have most interesting IT issues this morning, so none of us are immune to gremlins. So I just really wanted to kind of like pick up this slide because it's a little bit of a complicated slide, but I think that I'm particularly struck just listening to Carol's presentation before about the here and now, and thinking about where we all want to go to as a partnership going forward in Harrow, and as we put into place some of these more kind of like governance type concepts around the single CCG and the development of the integrated care system. At the end of the day, what really matters is how we keep on doing the doing, which we are employed to do for the residents of Harrow. And I think that we know that no one person can hold the ring on the wide range of projects that we are developing as a partnership. So we know that we need to have a very strong leadership system that will bring in the requirements of all of the different parts of the system, and we feel that this will be solidly represented as a quartet of leadership. So we will have our local authority leadership, and we will also then combine that with a local care offer, which will be led from primary care, community care, and from the mental health lead. And they will work together to deliver the type of change that we need to see in Harrow. And we are seeing this in actuality in Harrow, I think, already, because we are seeing the work of the Health and Care Partnership that IO is going to go on and talk about. And that actually is our real engine room for some of the changes that we are seeing, and all of the good work that happens in Harrow kind of like ends up going through the executive and the joint management board. And I'm extremely proud of being part of a system that is coming together so successfully. So we need to marry together some of the more bureaucratic elements that of course are part of our good governance plans, and marry them with the actual delivery of care for the residents of Harrow and for North West London. So if you could just move on to the last slide, the next slide on. So the next slide before I hand over to Aya is just to talk to you about health inequalities. So as we know, COVID has thrown into sharp relief the health inequalities that live in North West London and indeed in Harrow. And we are very aware of the need to accelerate our improvement in this area, something that we were all already aware of, but has been brought into sharp focus. So there is a plan across North West London to focus on health inequalities, and you will see here that there are three main driving forces to that work, which builds on working to do with issues to do with cultural change and supporting communities as they are, and that's work that's being led on by MC Patel, who's my opposite number in Brent and the Director of Health, a Director of Public Health, but also looking at economic regeneration, as we all know, an incredibly important part, and then looking at system delivery and accountability across North West London as well, so that we embed these changes in a way that actually make a difference for people. So at that point, I will just hand over to Io to take us through some of the specifics of the programme that we're delivering.
Thank you, Genevieve. I'm just going to move the slides. Please, can you let me know if it does move, because I'm having a few issues here with my screen getting stuck. Thank you. May I ask if you can see the process map?
It's disappeared.
I'll try again. Hang on. I'm sorry, I think I'm having some problems here. Can you see anything at all?
Sorry, I am nothing at all.
You can't. Oh dear. Okay, let me stop sharing and try again. I do apologise.
I think I've done it for you.
Oh, you've done. Thank you, Genevieve. I'm going to stop sharing then. Okay, Genevieve, I can't actually see it. It's
the slide with all the boxes, but if other people can see it, I hope I'm not the only one that can see it. Okay,
yeah, we can see it.
We can see it.
So
okay.
Out of hospital recovery plan we're moving to then, aren't we?
Yes, it is. Yes.
So can we quickly note the report from Genevieve and Javina, which is item 8, because item 9 was the out of hospital recovery plan.
Yeah, noted.
Noted. Thank you very much.
Thank you.
We're going to move to item 9, which is the out of hospital recovery plan.
Thank you. Good morning, everyone. My name is Ayo Adekoya, and I'm the Programme Manager for the Integrated Care Programme in Harrow, and I also help to facilitate the out-of-hospital recovery plan, or the implementation of it. So in September, I informed the board about the 100-day plan that we had been working through during the summer months to get us from planning how we would do the out of hospital recovery work to actually implementing it. So this update just gives a snapshot of what we've done in the last couple of months to continue with the implementation. So the slide here just shows us the status of the planning process. We've completed all the green boxes and are working through the grey boxes at the moment. So we've got 11 work streams and 2 subgroups on the programme, and each of the work streams that we have identified have got senior responsible officers now, management leads and clinical leads attached to them as well. The membership of the work stream includes representation from the various organisations around the partnership. So that's healthcare, social care, and of course the voluntary sector. And the approach that we've taken is one of working in partnership, because we see collaboration as a key element to enabling the success of the programme. We have developed terms of reference for each of the groups, and we've also developed logic models, which actually are just a tool to help us match the aims of the work stream and the outcomes that we're trying to achieve for our populations with the resources that we've got to put into the system across the partnership, and also the activities that we need to undertake in order to achieve those goals and outcomes. And going through that process has helped us to see the things that we've already got in place in the system and where there are gaps. And we have started, therefore, to be able to streamline our activity and to remove duplication where we've seen those highlighted. And it also means that we're now able to join the dots a bit better and take away some of the fragmentation that we have had in the system across health and social care. And we've been able also to connect a lot of people in ways that we just didn't have the framework to do in the past. We are developing into implementation plans now and cases for change where those are required. And so those grey boxes just show you the iterative process around that. Next slide, please, Genevieve. Thank you.
Yeah, it's up.
Thank you. Okay, and then this slide just lists each of the work streams with brief updates on each. So there are 8 clinical and 3 enabler work streams, and there are also 2 subgroups, as I said earlier. There's a subgroup on safeguarding and one on carers. The senior responsible officers for these work streams are part of the Harrow Health and Care exec, as Genevieve has said, and that exec meets every Friday morning. So any issues or blockers for resolution or discussion are raised in that forum and worked through in a sort of collaborative partnership way. Each of the work streams meet regularly, and some meet fortnightly and some meet monthly. I guess the only other thing to say is that there are some key threads that run through all our work. So one of them is comms and engagement with staff and our communities. And we're also working hard to support our staff with their well-being at this time. So last week, the chairs of the Joint Management Board, so Genevieve and Sean, sent a message to all staff across the partnership on behalf of the Integrated Care Partnership, describing ways that staff can really look at their well-being and offering their support in how to do that. This letter has gone out to all staff across the partnership. The last thing I guess to say is that one of the focuses that we have on this, which runs through all of our work streams, is of course tackling inequalities in our population. And all this, of course, is being done through the lens of coping with COVID and our response to it. Thank you, Genevieve. That's it. That's the end of the update. Thank you.
Thank you. Unusually, we move very quickly into 2 reports very close together. I would like to go back, ask questions if there's on both of them. So first of all, would like to welcome Sheikh Uladen. I think I might have pronounced your name wrong, but we will get to know each other over the next few months anyway. And just to, well, actually, Sheikh, if you want to introduce yourself about your new role, because this fits in what Javina was just saying about within the creating the new ICS and new CCG and the layout that we're going to have within that, and what Genevieve was saying about. We've also got to thank a number of people, but within the middle of all this, because Genevieve's been quite heavily involved with the work around the overall CCG. Interestingly, it's Harrow sort of took it over, because I was the vice chair of that as well for a long time, and under the new process I move into the ICS, where Genevieve is still involved with the single CCG status. So it's sort of Harrow leading the way in a sense. And Javina's put a lot of work into Harrow over the last few years to make sure it operates very well. And I just want to bring in Paul very quickly first.
Yeah, so for those of you on the board, you'll know that Javina has been on this board and part of the Harrow setup for some time now, and has made a huge contribution. And this will be her last health and wellbeing board in her current role. So I wanted to, on behalf of myself in particular, but the officers and partners, to thank Javina for her tremendous contribution to the place of Harrow. Now, I know Javina is going to say to me, she's not going anywhere and she will be back. So that's nice to know, but I think it is right and proper at this moment in time to pay tribute to Javina's leadership and to thank her for the work that she's done tirelessly, and for keeping us all in order and for making things work. And it's really been lovely and delightful working with you, Javina, and you'll be very much missed. And I know you're not going far, but we will love to have you back. I also just want to pay a tribute to all the partners that are on this call. Partnership is easy to say, but it's really hard to do. And I think the health and care partnership in Harrow has come on tremendously in the context of a huge crisis. So we have representatives on the call here now as part of the Health and Wellbeing Board from all our key partners in Harrow, CNWL, CLCH, the Acute Trust, the voluntary sector, the local authority, public health. Absolutely tremendous work that's gone into the recovery plan. And I think as we move forward into the new arrangement for an integrated care partnership, we are in a good place without being complacent. We're full of hope. We're recognising that there's a tremendous amount of work to be done. And it will also be very nice to work alongside and with Sheikh, who I know has made time to come on this call.
Thank you, Paul. Chris Miller.
Hello, yes, thank you. Thank you for the presentation. I was just in relation to the last slide and the subgroups, and there's a subgroup working on safeguarding. I just wondered a couple of things. Who's involved? Is that an internal sort of CCG restructure group of folk? And does it include new approaches to the child death review process? Because that's still quite immature and there's an opportunity here. And I just wonder whether the learning disability review sort of engine was in your rethinking around CCG ownership of that process. So it's all sort of one question, really. It's those three things: who's involved and what's the plan, I suppose, around safeguarding. Thank you.
Hi, yes, I can answer some of that question. So it is actually being led by Sue Sheldon, who's the CCG safeguarding lead for children, and she actually brought to our attention that she felt that it would be really helpful to create a framework, a safeguarding framework that each of the work streams on the out of hospital recovery plan could go through to assure safeguarding leads across the partnership of the elements of safeguarding that need to be incorporated into the work that we're doing. Yes, it is being run not just by the CCG, but being led by the CCG safeguarding lead, and she is working with all other safeguarding leads across the partnership to develop that. That work hasn't been fully developed yet, but they're working through that at the moment.
So if I can just follow, so the other safeguarding leads across the partnership, is that across the health economy partnership, or is that across the
health and care?
Right.
Yes,
so local authorities.
Yes, that's right.
Okay.
Yes.
So there are local authority folk involved in that subgroup, are there?
That's right. Yes.
Okay. All right. Thank you.
Thank you.
Thank you. We have some more hands up. We've got Sheikh Uladdin. Welcome to the meeting, Sheikh.
Thank you very much, Chair. I just would like to say a couple of words, and I think to follow on from what Paul and Javina and you've been saying earlier. So my name is Sheikh Uladdin. I'm currently the MD for Brent CCG, will be the coup for Brent, Harrow and Hillingdon moving forward. I've heard very good vibes about Javina's input, and it's going to be a big shoes to fill in. There's no doubt about it. But one thing I must say, I've sat in a number of meetings in the last week or so. Your integration agenda and your partnership working seems to be very well developed and very much in advance, in an advanced stage in many ways. And that is very much down to the partnership working that currently goes on between the council, the CCGs, the voluntary sector and the community providers, which is very, I would say, very mature in many ways. And I think there is here the opportunity to build on the good work that's already been laid out, and the foundation is already here. And I'm looking forward to work with all of you to push Harrow to the next stage and to the next level. I'm not sure it needs to be moved to the next level. It's already there in some ways or other, but I think I'm looking forward to do that with you all, and to build and forge new relationship as well with all of you in the council, which is very key and crucial if we are to move forward as a system. So all I want to say is thank you for the opportunity, and I'm looking forward to working with all of you moving forward.
Thank you, Sheikh. Genevieve.
Thanks, Graham. So I just wanted to make two points. So one is to pick up Chris's comment about the safeguarding, and also just to pick up about the learning disability aspects, because I think from that point of view it is really important, Chris, that we keep asking those kind of questions, because what we're talking about here is a Harrow process on top of what's happening at North West London scale. And I think that as we work our way through these changes, we do need to keep sense checking back to say what's happening at Harrow and what's happening at North West London. For instance, a lot of work's going in part of the mental health and learning disability and autism structure, which Sheikh is also going to be leading on, so you'll hear lots from Sheikh on that, around the learning disability aspects, the frequent reports we see about the inequalities that sit within learning disability going forward, and we know we need to put a lot of work into that agenda. That's the sort of thing that I think can sit very well at a North West London and a Harrow level. And I think that we just need to make sure that in a time when people are incredibly busy, that we are really clear who's doing what, so that we've got some ability to rely on others and not duplicate work. But where there are fundamental issues that are Harrow issues, we must work together as a partnership to resolve them. So I would say keep asking all of those questions. If you feel that we're giving you structures that don't make sense, then I know you will hold us to account for those. So I think that it's just a question of kind of like us all. It all feels a little bit confused at the moment, but I do have full confidence that it will sit right in the end. But I'm sure partners around this table will help us get there. The other point I just wanted to make was, as you can imagine, I'm delighted to hear the lovely comments of Paul has made about the work that Javina has done for the partnership, and I have worked very closely with Javina for many years, and I think we've both been on this board since its inception, and so you know, it is Sheikh does have very big shoes to fill, but I know he's completely up to the task. But I've thoroughly enjoyed working with Javina for Harrow. I get the privilege of working with her still going forward, but I would like to give my thanks to her officially at this board too.
Thank you, Genevieve. Christine Robson.
Yeah, thank you, Chair. Hello, Sheikh, welcome. I'm saying that very particularly because at the recent health subcommittee scrutiny, I was so enthusiastic about applauding Javina that I stopped you talking. Now, I just felt I needed to do something about that. I mean, you know, given me, who never stops talking, it's terrible to be stopped talking. So I'm trying on this occasion to do both things gracefully, which is to say, thank you so much, Javina, and I will miss you. Thank you for all that you've done, and welcome, Sheikh, and I'm really looking forward to working with you. Thank you.
Thank you.
Yes, thank you very much. There's a number of contributions within 2 reports, but also a number of thanks for the work people have put in over a period of time. And I think that's testament for the amount of work that has gone into the work of the people involved with the Health Wellbeing Board over the past 2 years. I became chair 2 years ago, in 2018, but I've watched it develop into something that, you know, managed to get us through a pandemic in Harrow, to that sense that people could have just pick the phone up and have that conversation, and we was always freely available to do that. And I think that's a testament for the amount of work that's gone on behind the scenes. So this is when I said earlier on about some of the reports on this agenda, they haven't just turned up. This is a lot of work by a large number of people working behind the scenes, not behind the scenes, but working collaboratively over the last couple of months, even during the pandemic, to make sure we can get where we are today. And that only works with the people you have in place. So I'd like to extend my thanks to the people involved, and say thank you to Javina for the role that she's done in Harrow for this period of time. And welcome, Sheikh, for the role you've now got to take on. I would say that meetings I go to, I sit there listening in the background at times on a number of the health meetings, and I like the way that they talk about the health partnership in Harrow is a beacon of how other councils and areas should actually look to emulate. And I think that's a good testament. You know, they don't probably know that I'm there, but I'm listening to these comments and I think, oh, that's quite nice. But it just goes to show it doesn't come about by small pieces of work. This is people put the time into things, and we end up with something very positive. And these 2 reports we've just come to, you know, they're a hard piece of work to follow through, and I think that's the challenge that Chris has come back with, quite rightly in his role as the safeguarding chair. But it shows that we can have those conversations moving forward, and we don't have to do things, wait for meetings to happen, and we can get on with it and work in that gap. So thank you very much to everyone for those points, and to Genevieve as well, you know, because as the vice chair of the Health and Wellbeing Board, we wouldn't be here without you, Genevieve, because you're also involved with that London conversation, which was quite challenging at times. You know, when I think it was Mark Easton, when he was sort of running it for a while, you know, it's sort of there was a lot of meetings taking place at that time, and they've moved from 6-hour meetings down to sort of like a more sensible 2-hour meetings because we have those relationships built up. So thank you very much. And the recommendations on, we've agreed to item 8, although with the added part that Chris has just raised and that's been responded to. So item 8 was to note the reports, and item 9 was to note the reports and continue to support the implementation process as part of the Harrow out of hospital recovery plan. So that's all agreed. We now move on to item 10, which is the adult social care strategy, and I believe that's Angela. So if I just stick it up on, see if I can get it on the screen.
Thank you, Chair.
Yeah, is that the one?
That's great. Thank you very much. So this is an opportunity for adult social care just to highlight the fact that we're refreshing our 3-year plan. It gives us a platform to enable citizens' choice and control by focusing on enablement, with working with our citizens and community and carers, re-enablement, and more of an emphasis on preventative services. So the strategy allows us to plan together, that's with our staff, our partners in the NHS and the voluntary sector, and also very importantly our citizens. And it gives us that ability to explain what we want to do. It's very much, this is the beginning of our 3-year journey, building on what we've done before, but it's very much, as Chair, you mentioned before, a dynamic strategy, and the work sort of begins and continues now, and it's building on the strengths that we've already established with our citizens and their carers. So our mantra is very much Harrow is home, and it's building on that stronger community. Our vision is a home first philosophy, and to support people at home for as long as possible. Now, inevitably, there are elements where that isn't possible, and we want to be equally as positive with our citizens about moves into residential if that's the case. And we have a very proactive quality assurance team, which we work very closely with our partners to ensure that the care is of the highest quality, and we work with CQC very closely there as well. So our priorities to be able to activate this plan is to put citizens at the centre of what we do, nothing about me without me, to protect adults at risk, and to continue to strive to improve our services. We don't always get it right. It's very important that we learn lessons from that. We hear from our citizens when we haven't got it right, and we're able to work to improve it to get it right next time. The principles behind this are ensuring, as I said, that we put the citizen at the centre of what we do and their care and support. Supporting people to be safe is critical in the work that we do. That we have a shared responsibility with our citizens so that we connect with our colleagues in public health, leisure, health, all the elements that we would want to do in the community, and that we're able to enable our citizens to be able to participate in community life. Previously, there had been quite a focus in adult social care about the assessment process. We're turning that round with the work that we're doing on strength-based work and focusing more on prevention, working much more closely, as I say, with our colleagues in public health. Quality of care, as I said, is a key theme, and it's that golden thread that threads all through what we're doing. And very importantly, that what we've heard today is building on integration. So as we've heard today, Harrow has made really good strides in terms of integration at a strategic level. So what's really, really important is that the frontline services were able to support our staff to work in a seamless way with our partners, and integration is one of our key elements that we've been working on year one. Our workforce obviously is very much key to delivering this, our frontline staff, and looking much further than social workers and OTs and physios, as important as that is. This year particularly has driven home how important the social care workforce is, and that's staff working in independent care homes, sheltered housing, domiciliary care, personal carers. And we're very pleased in Harrow Council to be part of the Proud to Care, which is a national campaign which is looking at how we can attract people into the care sector, give them the right training and support, which is all benefits our local citizens and delivery care that we're doing. And in essence, that's the key to it. We have, which I won't necessarily go through, but the last couple of slides are the actual action points that we are looking to deliver on that, and that's by using the resources we have, as I say, to shift towards more prevention, so doing work with our citizens with a learning disability about how to enable people to access the community and maximise their life choices, looking at how we can support our carers, absolutely key theme, and that's reflected in the integration work that's happening there as well. And developing ways that we can support more of a dynamic outreach model rather than a limited brick-based support in the community. So our strength-based approach, which was started over a year ago, was actually looking at how we work to connect with our citizens, and it's quite often called it 3 conversations. So it's about making sure that when our citizens approach us, that we're there listening to them. We are able to respond to them at that particular time. So if it's a crisis at that time, we can respond to that in the most useful way, step back, but say to our citizens that we are here if you need us in the future. But actually what we're doing is enabling them to stay in the community and work with the community strengths. I suppose one of the more exciting elements which we're all struggling and working with and benefiting from at the moment is technology. And what we do think is that if that's focused in the right way, this can really be a game changer for some people to stay at home in a much more independent way. And so we're looking at different ways that we can enable our citizens to benefit from technology that is bespoke to their needs. And that is the short summary, and happy to take any questions.
Thank you, Angela. Is there any questions, Chris?
Yeah, the assistive technology, always love that. Do you have a sort of an assistive technology board? I mean, how do you know I mean, there's so much of this stuff. How do you make sure you're calling upon all of the sort of thinking that there is, and also Harrow is, you know, great but relatively small. How do we make sure that all of this is being sort of worked through with perhaps the whole of the North West London CCG partnership footprint?
Yes, so it's a really good question. So you're quite right that there's been lots of talk over the last, goodness, about probably 10 years about assistive technology and smart homes and how that can link to the health and social care. And you're particularly at the moment, the market is flooded. So what we've done is we work with ADAS across London and nationally to look to see if there's been examples of where they've tested and tried it out. We have a project ourselves, which was started before COVID, which is looking about how we can respond to people's needs within their house, so using sensors. And we have a board which is evaluating that at the moment. So that's how we're trying to make sure we're benchmarking, staying up to date, but not investing in technology that won't have the return for the community.
Thank you. And Marie.
Morning, Marie Kate from Health Watch. It was just that, thank you for that, Angela. It was just 2 quick questions really, which are very much linked to the focus that Health Watch has at the moment. One is within that, how we're identifying the needs for the BAME community. And secondly, as a general view across all of the services, how do you, it talks about the citizen and nothing about me without me. How do you currently capture the views of people that are receiving your services? One of the things from a Health Watch perspective we always struggle with is that sharing of intelligence, and I'd be just keen to understand, if not in this meeting or outside, it is what mechanisms you've got in place to monitor that the services being provided are meeting the citizens' needs.
Yeah, so we have a number of questionnaires that go out regularly. And so we're able to, that's both, we participate in the national, but we have local with some of the changes that's happened in Harrow recently. We've had a couple of questionnaires. We of course work closely with yourself, and I know that you've come to our teams to talk about the work that you're doing, which is really helpful. We then plug into, obviously we're part of the council, so in terms of our response to the BAME community, we're looking at the number of people who are able to use our service. If we're in a sense, are we responding to those? We have a complaints service which looks at the number of complaints come in, and that's documented into, we have quarterly updates with that, and then we have an annual review of that to see if there's any area, if there's any themes that are coming back that we need to work on. But it's something that we have to constantly strive to. We are aware that sometimes we have some parts of the community that feel able to respond and engage more than others. So we have to be careful that we're not overlooking all parts of the community.
Yeah, no, thank you. That's the sort of intelligence at some point, whilst we can't have personal details, but the trends that get identified through this work would be really interesting to talk to you about at some point. But yeah, I think the hardest, which is the issue we find, and I'm sure you're the same, is if groups don't want to talk to us, then you don't get what they're hearing, you know, you don't get what their issues are. So it's how we collectively work together to try and get that. No,
yeah, very happy to continue that dialogue with you, Maureen. Yeah.
Right, thank you.
Sorry, thank you very much. And Simon?
Thank you, Chair. Yes, I just want to endorse what Angela has been saying about our adult care strategy going forward for the next 3 years. For me, I was going to say I've got the 3 Ps, but in fact I just looked down and I've written 4 Ps. And the first one is person. We have to ensure that our services are person-based. Angela's quite right to say nothing about me without me, and that must be one of our key mantras, to involve the person and their family and their carers in all the work we do for them and with them. The second key thing, for my mind, has always been prevention. The more we can work on prevention beforehand, the better it is, both for the resident, for their families, and for us as a local authority and a community health provision, if we can prevent people before things get worse. And the third one, and you can see it in here, is to promote independence, because it's much better if we can work with families and residents for them to stay in their own homes or to stay in the community. And you will see that we are bringing online some more extra care beds, which have been much needed in Harrow, to boost the number, and then some more further in the 3 years following to give another option to allow people to keep independence rather than going into residential. And the last P is, of course, partnership, which we've all been talking about today, which from my mind and from the council's viewpoint is so important, that we're all working together to provide the service for everyone who lives here in Harrow. Thank you very much, Graham.
Thank you very much. Yes, thank you very much, Angela. As you said, it's a very important programme of work going forwards, and it's quite key to what we'll be able to deliver. So we'll be keenly watching it as we progress, because there's some quite challenging scales in there as well. So the recommendation on the report is to note the report. Can we note the report?
Noted.
Thank you very much. We now move on to item 11, which is the mental health strategy, which I believe is going to be Joe and Lawrence.
That's right. Thank you, Chair. We've got a presentation which I'll just try to share with you. And I'm hoping that you can now see that.
Yes, you can. Thank you.
Good. OK, thank you very much. Yes, together with Joe, I'd like to present the approach we're taking to some mental health issues in Harrow. I'm going to explain the extent of mental ill health and some impacts from COVID. And I'll quickly cover a bit about policy, drawing out the health and wellbeing strategy there. But then I wanted to highlight CYP, emotional wellbeing, and then I'm going to hand over to Joe for the review of the community mental health services. So I did just want to mention also, this isn't an exhaustive list of what is out there, and it's just a review of some of the key things that are going on. So just to set the scene, the burden of mental ill health. Poor mental health is very common, but it's frequently hidden and it's undiagnosed. So we can see here 1 in 4 people have a common mental health disorder, and that's approximately 30,000 people in Harrow. But we also know that 50% of mental health disorders occur in childhood. So prevention is key, and early intervention is key. The estimates again here suggest that 1 in 8 have at least one mental health disorder, and the Young Harrow Foundation have quoted 20% of children saying they either need support themselves or know someone that does. The other implication I wanted to draw in here is that there are several known cohorts of the population that are at risk of developing poor mental health, particularly pertinent to Harrow, the extensive BA-ME communities. And many of these risk group sort of characteristics for mental health will amplify inequalities. And therefore, in our response, even outside of COVID, our approach to mental health is fundamental to how we tackle inequalities. But let me just quickly review the COVID impact. We know more people will become at risk of poor mental health with the impacts on the economy, education, and housing, for example. And we already have some evidence of this impact. There are doubling rates of depression, high numbers of CAMS referrals, and applying some basic modelling to what's happened in previous economic downturns, for example, we can estimate that there's going to be an additional 1,400 people with a common mental disorder by 2029. That also translates into 1,300 people, an additional 1,300 people on the care programme approach by 2029. So at the bottom there, Harrow Mental Health Services need to adapt. And I think that's partly what this presentation is trying to address. So these slides, moving on, show a couple of examples of how we're looking at this in Harrow. The policy slide here shows the growing recognition and importance of mental health. And I've shown here the ambitions of the 5-year forward view, but I wanted to show our local plans building on these ambitions. And I wanted to particularly draw on the health and wellbeing strategy at the bottom there, 2020 in Harrow, and also, of course, the borough plan, and as we discussed already today, the recovery plan and hospital plan. Now, the health and wellbeing strategy defines a life course approach. And just on the next slide, I just want to outline what we mean by this in relation to mental health. So it's a broad approach to mental health. On the left, we have the service framework, starting from the universal preventative elements at the bottom, ranging through to early help, moving into more acute care at the top. So that's the range of responses that we can expect. But against this, and the health and wellbeing strategy on the right-hand side, is this life course approach. And so it's defining each of the services on the left for each stage on the right. So, for example, in early years, there may be a need to particularly support parents. In the children and young people phase, where children are rapidly developing, there's the PHSE curriculum or the CAM services. For working age adults, there'll be initiatives to recognise and cope with stress, for example. And in older people, a focus on physical and mental health, for example, social isolation or transition. So that sets out a broad context of how we can approach mental health. And then I particularly wanted to just mention a little bit about schools, the importance they have in securing a secure emotional well-being amongst students, and recognising a whole school ethos and approach to emotional well-being, and also the successful bid that I think we mentioned at the beginning of the meeting regarding the mental health support teams. Now, what I wanted to do very quickly is illustrate just how complex a picture this is for the provision of young people. And the next slide, you'll be relieved to know that I'm not going to talk through every element of this, but this just gives a flavour for the range of services that are provided by different commissioners from the CCG, the local authority, and from the voluntary sector themselves. So as you can appreciate, there's a lot happening, and it's trying to work with the schools to understand this and to define those interventions that they think will work particularly well in their own schools. We've done a bit more work on this, which is on the next slide, where we start trying to map these services to this sort of this range of provision. So this is the Thrive model, the getting advice, so the basic signposting, self-management and one-off, through to getting help, getting more help, and then getting risk support. And then all we've done very very simply on this slide is try to map some of those services and provisions in Harrow according to each of those boxes. And so this is what I'm so this is the view that we have for mental health services and interventions in Harrow. And so the question is, for me and my team, is what is the work that we must do? And it's quite simple to state, but probably more difficult to actually implement. And that's ensure that the services that we have fill whatever framework we choose to adopt. To say the Thrive model here is good, is a good certain starting point. But it's how we help the schools choose how they wish to approach emotional well-being themselves. So it's actually working with the schools to understand the level of need, understand their the particular cohorts of children within those schools, and what interventions and assets we can deploy to the most effect. So that's all I was going to say on CYP and emotional well-being. If I can now hand over to Joe, who I'm hoping is online, to talk about the community services review. And Joe, I will move the slides on for you as you tell me to.
Okay, thank you, Lauren. So I'm going to talk through, just in summary, the mental health strategic review that the local authority commissioned to look at the services that we either commission or provide that support mental health recovery. I think, as Lawrence has just outlined, for children and young people, the landscape is quite complex for mental health, with a range of providers from CNWL, who are commissioned by CCG. They are also commissioned by the local authority to provide the adult social care functions. The local authority provides some direct services. So, for example, WiseWorks is a service that the local authority provides. We also provide some accommodation. The local authority also commissions providers. So Rethink is a large BCS organisation that we commission to provide services, community services for the bridge. And we know that there are a wide range of BCS providers that we actually don't commission, but they provide very important services to support people recovering from mental health. So the landscape, I think, is, to start off with, is quite complex. But there was very much a view that it would be timely to look at the whole recovery pathway, to see what the effectiveness is, and to be clear that collectively that the services provided maximise people's independence and social inclusion. And there on the first slide, you can just see some of the other services that are actually provided in Harrow. So next service, please. Next slide. We commissioned an independent consultant to undertake the review for Harrow. This is important to get an impartial view of what was happening and an impartial assessment, and also to bring in wider best practice and other services and processes that were happening in other parts of the country, different local authorities, because I think that it's really important that we look beyond the boundaries of Harrow to see where best practice is. The consultant adopted a methodology whereby she met with a number of focus groups, which were established groups that were were provided by CNWL, Rethink and Harrow Carers, and she also sent out some questionnaires. The commission started at the beginning of the year, and then we hit COVID, so unfortunately we weren't able to complete one strand on employment, but that's an area that we do need to pick up in future to actually complete this piece of work. But it was felt that there was sufficient evidence that actually we could move forward in terms of the findings and the recommendations. This slide outlines the key findings, which we've translated into recommendations, which I will talk through. But I just wanted to make reference to the independencies that we have, and I think that they have been very well articulated through the previous reports and presentations that you've received. So very much about looking at the person-centred approach coming through from the adult social care strategy. There is a specific work stream around mental health in the out of hospital strategy and the recovery pathways. And this is very much part of the integrated care partnership. So we do need to look across North West London as well, across the system as a whole. And we have the new model that CNWL have implemented from earlier on this year, I think it was around September, which is their community hub model based around the primary care networks in Harrow. So I think it's important to recognise that all of this fits together, and this is the system that we're working in. So the key findings are listed on this particular page. I think the first one is that there was an absence of a whole systems approach. So I think this is a really good opportunity for us to actually address that and look at work in a more systematic way. And I think that is really happening now through the out of hospital plan, but also the strength of the partnerships that we have built up that have been referred to prior to in previous reports. There was a view that the provider services created more of a dependency rather than enabling independence. And we can touch on I will go into more detail about this, and as Angela's already referenced in the adult social care strategy, that there's a need to move from a buildings-based approach to actually looking across the community about increasing the offer that is available. The third area of the findings was to do with the accommodation and a recognition that there wasn't the right pathway of accommodation for people to progress to a greater level of independence and living in the community with the necessary support. There are a number of factors that relate to this. One of them is the challenge for affordable housing, which is being addressed through the Regen scheme. But also prior to that, we need to make sure that we have the right type of providers in Harrow so that we have the decreasing levels of support that enable people to achieve independence and living in their own home. The fourth area was the lack of recognition of the strength and the value of the VCS in Harrow. We commission Rethink, which is a VCS organisation, and we do work with Mind in Harrow and some other providers. But I think one of the things that has really been highlighted in the response to COVID has been the strength of the VCS and the fact that there are a multitude of organisations that are providing very valuable services to people. And moving forward, we need to capture how we work more in a more collaborative way with the VCS, both large organisations that have a regional and national profile, as well as those small organisations which are very specifically focusing on local communities. We're doing this through several strands, but two of the key ones are again with the out of hospital plan. There's been a commitment by the local partnership in Harrow to support the VCS to develop their business model and to see how we can best work in an integrated way with them. So we will build on that work in moving this forward, but also working with them to develop our future models of provision. The fifth area was the acknowledgement of the essential role that carers provide. And again, this is an area that's been picked up in the out of hospital plan and within the adult social care strategy, that we need to ensure that how we're approaching carers is aligned with the wider picture and the wider approaches. And some of this work is being taken forward already. We now have a carers post within adult social care who is developing that outreach and offer to carers. So what I'm going to focus on now is the community-based activity. So can you move the slides, please, Lawrence? So one of the key finding is around the need to develop our community-based offer for support services. And this is very much about looking at the individual and making it a very person-centred approach. We also need to acknowledge that if we are now living in an era of COVID, and we need to be thinking about this and planning and designing this with COVID, rather than just ignoring it, because actually it's going to have quite a long-term impact, of which we don't know, of living with COVID in the future, but also the effects of COVID. So the drivers include reference to maintaining health and well-being of service users during the COVID pandemic. We're also needing to recognise the fact that there will be increasing needs in terms of mental health support that have arisen predominantly through the COVID experience. So an increase of unemployment, financial stress, or bereavement. We know there's an increase in prevalence for mental health, and we need to acknowledge that in how we move forward. Recently, there's been a lot of work to continue an offer to service users from the Bridge and WiseWorks. It's a virtual offer, so we've been using technology to continue the communication and some of the activities with service users, and that development will need to continue whilst we're in the COVID lockdown, or whatever the tiered and social distancing requirements are. But actually it's also looking at how we use that as a mode of offering services as we move forward. The last bullet point I want to draw your attention to is really looking at how we use the provider to help us develop the services as well, so that it's very clearly recovery and resilience, which builds on the points that Angela was making in terms of the approach to adult social care. Next slide, please. In developing our community model, the approach we're going to take is very person-centred, so it's looking at all areas of the person's life, so the friends, family, lifestyle, skills, experience, volunteering. Again, making sure that we coordinate the support around the person at the right time and in the right place. Next slide, please. We're then looking at our community-based model to ensure that we have access, that people are able to access the full range of opportunities for support. And this diagram just illustrates that you've got the acute mental health on the outside, community-based, we've lost it, community-based services, fine, and then looking at what is available so looking at the leisure opportunities, for example, the libraries, what facilities and services are available on a universal basis that can be accessed, and then looking at the closeness, the personal circumstances, areas that can be supported. We're looking at a model that's been developed in Somerset, which actually brings together these strands so that it's a very integrated offer that links in with community services as well as the health services and the specialist support. So the next slide, please. Can you flick to the next one? Lovely, thank you. So the next steps I think are really key. So we're very clear about the approach that we want to develop, so that we want to adopt a co-production approach, so that we build our services based on the life experience of service users and citizens. And it's important that we try and involve the widest community of service users, and we need to develop our reach to broaden the current contacts that we have. We've already started the engagement through the review and working with focus groups, so we have a starting point, but actually we need to develop that further. We will then look at the redesign so that we have a whole systems approach, and then we will obviously be looking to implement and develop that. I think there's we're working very closely with the current provider of services at the Bridge, Rethink, and our ambition is that we continue to work with them so that we develop a model that has a transition from where we are in the virtual COVID offer to something which is very community based, has been designed through co-production, and actually really brings together all the elements that are available to us. And the final slide, please. So I think between Lawrence and myself, this is the sort of the conclusion that we're trying to bring to you, that mental health impacts all the time. We need to understand where the key risks are that help us design and develop the partnership response, that we increase the awareness of mental health, and I think that's particularly essential currently because of COVID, although I do think that the profile has been raised. We need to ensure that there is a tiered approach both for children and young people and adults, and that actually the design starts off with the individual and is very person-centred. Thank you.
Thank you very much, Jo and Lawrence. Is there any questions? Janet? And then Chris.
Thank you, Chair. Yes, I just wanted to mention, as a care champion, I received something from Alison Bryce to all the carers, and it was a slide called "This Is Me," which is really important, and it focuses on Alzheimer's and dementia, and also it's a wonderful chart where the person or the carer fills in information about that particular person, and I think it's really worth looking at, and it's absolutely super. It is really good, and I got it sent yesterday, but it's something that you need to look at and promote as well. And I know that Maxine is another care champion with me, and I'm sure she will be promoting it as well. Thank you, Chairman.
Thank you, Janet. We'll come back to all the answers at the end, if that's because I agree with your points and I want to raise something else about that. Chris. You're on mute, Chris.
That's normally good news for most people. Do you see any space for sort of online help, online access? We used to commission an entity, I think, called Big White Wall, that we don't anymore, who provided online support for people early in their journey with mental health concerns, and whether COVID has sort of moved your thinking on with that.
If we take all the questions and they can come back, and if we got supplementaries, we can be quite brief. Marie, and then Gazumpha.
Hi, so mine's probably more of a statement than a question, and I know Jo and I have met to talk through this. I think the two things that spring to mind for me from a Health Watch perspective are the impact or the potential impact and how we manage it if somewhere like the bridge does close. It's fine talking about everything being virtual, but when somebody is having mental health issues, it's making sure the package of what is there meets all needs. And I would expect there would be some reaction if something like the bridge were to close and virtual office in its place. So I think we just need to be sensible and recognise that. And the other bit for me, which again, Jo and I have had this conversation, it's about, you know, if we are doing this co-production, I think from memory, the team we were talking about is trying to recruit about 8 people to get engaged in this. It's about making sure across those people that are engaged in the co-production, we get the right mix. And it's about how, as a board, we can all promote and make sure we get the right people in to help with this co-production. I say a statement, not a question, so apologies. Thank you.
It's an important statement because people get drawn into protecting a building because it's don't like change as much. Gazumpha.
Thank you, Chair. Thank you very much, Jo. It's a lot of hard work I can see on your on this report. My main concern is because during the last 7-8 months, due to COVID-19, there's a Christian community, and as you mentioned, and the Fani communities, they are suffering more because of their pressure of financial pressure, homelessness. So how do you get in touch with those communities? Is it through the organizational work, or the cases are reported to you? Because my concern is these communities, they just sit at home and they don't get in touch with any other bodies or community organization for the help. So this is the main issue at the moment, because I know a few cases and I've already advised them to how to go through, like Mind or ManCap. So how you adjust because during the last 6-7 months when the things have got worse, and how you tackle it? Thank you.
Thank you. And we have one final question from Genevieve.
So it perhaps is starting to answer some of the questions as well, but I think that we just need to bear in mind, I think actually this is a tribute to the Health and Wellbeing Board, that we've had a report that probably 3 years ago would have been completely CCG dominated, and actually we've had here a report that is about the work that spans across all of the different parts. And it wasn't that they wasn't going on, it's just we weren't joined up, noticing all of the things that interrelate. But there is a Couth offer, Chris, that people may talk to, and I think I want to also remind everybody that general practice is open and that actually people can access their GPs. A lot of the consultations that I'm doing at the moment may start with something that is perhaps a physical complaint, but every single person has got a mental health story to tell, and they just need the space to be able to do it. There's lots of support and offers out there. I know Tanya's on this call, and I'm sure she could say a lot about what CNWL is doing, but I think that ultimately what we want to do is, as Joe said, allow people to have these conversations, get them into the right places. So I just wanted to kind of like start some of the answers that others will probably give more detail on.
Thank you, Genevieve. So Joe and Lawrence, there's a number of points have been raised. Did you want to take it in? I don't know who wants to go first.
Okay, should I start with the online offer, because I think that Genevieve has already made reference to that. We do, there is a Couth offer, which is an online service for children and young people, including which is offered in schools as well as the college, Harrow College. For adults, in terms of during COVID, Rethink and Wiseworks have actually developed an offer that includes a range of activities which have been provided. Some of them have been telephone calls, but some of them have actually been using video platforms, as we're using as well, to engage with service users. And I would expect that that will be an element moving forward. I don't believe it's the one and only. It's not the only mode of communication or the channel to provide services. And I do think that increasingly the contact with people in terms of a sort of a social isolation or just the need to socialise is actually key, and we need to ensure that once it's safe that we can move into that space. In terms of the community-based offer, we're looking at developing the offer, and we're not looking at not having any building-based activity. It's just currently at the moment, because of COVID, the bridge is closed along with all the other NRCs that the council operates, so that we can ensure that we have a COVID safe environment, which currently they wouldn't be. So that's why there isn't the face-to-face now. But the community-based offer needs to be co-produced, and I think it would be wrong of me to say what it's going to look like when we need to do that piece of work. But I'm by engaging with the broadest number of service users, I think that that's the best way that we can actually develop the solution. In terms of reaching the hard to reach groups, I think you're right, it is really challenging, and we do acknowledge that. Genevieve has just made reference to the fact that the GPs are open and the surgeries are open. And I think it's part of our communication and engagement is actually seeing how do we use those channels that are available to us across an integrated system, which is the council's service users. We have a number of databases that we can use to develop our communication strategies. I know that there is work that is going on with the integrated partnership, which is looking at how using the GP's communications channels with their patients, and also linking in with Healthwatch to help to see if we can use some of their channels for reaching out to a wider community. So I think that we've got work to do on it, but I do think that we are at the beginning of a journey that will increase our reach into those hard to reach groups. Thank you.
Thank you, Lawrence. Did you have anything to add?
No, I don't think I did. I think that was a very good summary from Joe. I would just, if I added anything, it would just be about the schools offer, and I think I talked quite extensively about that within the presentation. But that's obviously a place where we would be expecting to identify any emotional wellbeing concerns, either with the children or their parents or carers, and so that's obviously the viewpoint from that piece of work.
Thank you. Gazumpha, you put your hand up again. Was it a quick point?
Yes, I just want to come back to Dr. Small, that to get in touch with your GPs. I mean, my own personal experience, because I got some issue in my home, my son, and I mean, it's very difficult to get hold of GPs because you speak to the nurse reception, you leave your telephone number, then you wait for a doctor to come back to you. My son phoned, I think, on Thursday, Friday. He suffered a little bit from epilepsy and also a bit of depression. So he was patient to Dr. Lloyd. And again, I reminded, please go back to your surgery and ask for consult your doctor because he's running out of his medication. So this is also, I mean, to get in with your GP is becoming very difficult nowadays because there's no face-to-face appointments. You only have to go indirectly through a reception, then doctor, and doctor have to call you. If you miss the call, then there's an issue. So this is Dr. Small is a concern in the community because particularly if you miss a call and nobody come back to you. Thank you very much.
Thank you.
Main concern at the moment. Thank you.
Yeah, thank you, Gazumpha. Before anyone answers, I've noticed the time is 12 o'clock. Could we've got one more report on the agenda, which is a key report around safeguarding. So can we just extend the meeting by up to 15 minutes and then just to make sure we can get to that report? Genevieve, did you want to answer the question from Gazumpha? And I think Tanya wants to respond as well.
Yeah, thank you. Apologies that my signal's not enough to be able to put my.
You've disappeared.
But I just want to say that general practice is open, but it is offering appointments, and we're just making sure that when people have appointments that we absolutely need them face to face physically, but I think that, you know, I appreciate it's a very different offer to the offer that people are used to, but I wouldn't want anybody to go away from here to feel that general practice isn't seeing patients. They absolutely are, and we're also seeing people on videos, but we are doing all we can to make sure that we're maintaining the service in a perhaps a different way, and I appreciate that doesn't suit everybody's needs, but I'm very happy to pick up the councillors' issues offline for the particular case.
Thank you, Genevieve. Tanya, did you had your hand up and it disappeared?
Yes, Chair. I'd just like to respond as well on behalf of CNWL and Mental Health. Just to say that obviously we do take referrals via GPs, but service users or residents of Harrow can also refer themselves to our talking therapy services in IAPT. So if somebody's feeling low or whatever, they are able to actually make their own self-referral into those services. And just to add that CNWL throughout the whole of the pandemic has continued to do face-to-face assessments if a service user requests that, and obviously face-to-face one-to-ones as well throughout, also home visits and telehealth as well. So we've continued to have our doors open. Referrals have increased, but we are continuing to maintain that we do see any assessments within the 28-day period. So I just wanted to add that, and also just to add around the social care changes for our mental health, I very much support these. I see it as a really exciting time to actually work together and make sure our pathways are integrated. Thank you.
Thank you. I don't see any other hands up. It's been a very detailed report that's been made, and I think it's a very important one. And going back to Janet's point, it is key. It's not just the people themselves, it's also their carers and support network they have in place. And a lot of that is drawn out through the report. But we know from COVID that the number of people accessing services earlier on has dropped. But knowing from other data that's collected across the health partnership, we know that there's an emerging sort of growth, rapidly growing level of number of people who would need support over the coming months. And accessing that in the current arrangements, we just wouldn't be able to cope with what we have in place. So the development of what you're doing and co-producing it, I think is, it's going to manage, well, not manage, but support a larger number of people earlier within the whole of process of accessing support. So the recommendation on there is to approve the recommendations. So as the board members, I can see enough people there. Do we agree the recommendations?
Yes.
Excellent.
Yes.
Thank you very much. And we now move on to item 12, which is an important report, which is from Chris and Sue, the Adult Safeguarding Board Annual Report. Everyone's seen this, I think, has been part of it, and Chris has circulated it previously. But
yes.
Chris, are you?
Well, look, yes, so I think I'm doing, there's two reports actually, Graham. There's the adult report and the children report, which has been snuck in under the door. I'm assuming that as a group, you aren't totally thirsting for my presentation that I would have given because we're up to time. So I'll just briefly summarise where we're at. The reason these reports tend to turn up in the late autumn is that the data upon which some parts of the report rely is not ratified till June, and therefore getting it in for the September board meeting is always a bit of a squeeze. So obviously this is a bit historic. You will note that both reports this year are written in a different style from the way they had been written for many a time. We trialled out the children's one last year and that was quite popular, so we moved over to the same style for the adults one this year, more sort of magazine style. So a narrative about what is going on interspersed with some sort of anecdote and real life stories about what the partnership's been doing. This is the first annual report for the children's partnership under the new arrangements, and it isn't the same as the previous Safeguarding Children report. It's the report of the partners. You'll notice that in both reports, I have done a summary of where I think the partnership has made good progress, achieved well, and is on the mark, and other areas where I believe there is work to be done in terms of getting to where we want to get to. Under the children's arrangements, that is a requirement of mine, and we decided as an adult board I would sort of replicate that for the adult board as well, because it may be a helpful way of doing some thinking. You'll also note that our three priorities that we have selected across both boards are domestic abuse, mental health and well-being, which is very relevant given some of the presentations we had this morning, and contextual safeguarding. And for those of you that aren't wholly familiar with that term, it's about seeing safeguarding in the context of the whole family, personal and social life that both a child and adult lives in. So it's not just their family, it's the whole lives that they live, and the complexities that bring. So I would want to wrap up by saying the partnership has been fantastic. Both the people on the ground and the leaders that represent them are very engaged, very committed, and very easy to do business with, which doesn't mean to say we all roll over and tickle each other. We don't at all, but we take challenge in a very good spirit, and there's a very good leadership atmosphere from top to bottom in all the agencies that I have the pleasure of working with. So thank you to those of you that are part of those leadership teams, and if you're not, you should be very pleased that you belong to leadership teams that are like that. So that will do me, and I'll take any questions that anybody wants to put in my general direction.
Think you very much, Chris. Is there any questions, or did Sue want to add anything?
Not sure that Sue's here, is she?
No.
I think she took the leadership points and left me to it, I think.
Janet, you got your hand up?
You're
yeah, thank you, Chris, very much. I've got fire engines going past. What I wanted to ask on the HSAB attendance record, who is the Harrow Council elected shadow portfolio holder? Because you've got it down as naught in the attendance, and I just wondered who it was.
I will have to get back to you on that one, Janet.
Okay,
that is data that was provided to me by my good folk who administer these procedures. So I can't answer them directly. Okay.
Okay, if you get back to me, that'll be perfect.
Okay. All right.
Thank you.
Yes, is there any other questions? No. I can comment though, because I can take the chair's privilege of doing so. I think in a way we've dealt with a lot of issues today, and it's giving the scope of what the health partnership, that's the health service and also the council has to deal with. But at times it goes that one step further where we end up in quite a very serious situation, and this is the area around safeguarding that we've got to make sure that we can sort of deal with the challenges that are coming through. And some of it is not as straightforward as we've seen. The presentations we had when we was allowed to meet pre-COVID time, I thought was very good. You know, it explained a lot of what people are doing across the partnership to try and keep people safe, and that's the main part of what the board does. It also raises a whole range of issues around potential harm that could come to people around domestic violence, and trying to make sure we target the services in the right place. So we'd like to thank Chris for being to this is actually it's been in the post 18 months now since we changed the partnership around to set up the new board and new processes and procedures we have in place. And I do meet with Chris on a regular basis along with the chief executive, and I know the cabinet members also do. We need to work make sure that the shadow person is as well brought into the safeguarding programme, as Janet has highlighted. But it is it's a daunting piece of work at times, because we can see from the reports in the press of what happens when something goes terribly wrong. And sometimes, you know, we can step in a lot earlier and we find that out in the reviews, but the review is always too late to actually deal with the person that's been affected. So there is a lot of work going on. It's a hard-working team, but sometimes not recognised as much as some other teams that are more high-profile, I think. You know, we always hope that we don't end up in this position, but sometimes we do, and we need to make sure that we've got that support around. And that's what the report highlight brings out, and shows you the challenges that we're facing in what I call the leafy northwest London borough of Harrow. So it's quite a challenge in itself. So thank you very much, Chris, and all the teams that are involved, and Sue, who's still there. It is one of those reports that comes in later than normal, but can people note the report? Thank you. The final item on the agenda is any other business, and we have one item on any other business, which is from Paul Hewitt.
Well, actually, it's probably Health Watch, and Mary's on the call. It was just noting the Health Watch focus report, but Mary has already mentioned it, but maybe she just wants to highlight the just in a few sentences that the focus of Health Watch over the next few months.
Yes, thank you, Paul and Graham. Yeah, due to cuts and everything else, we've had to be very practical with what as a Health Watch we can deliver. Working with both Javina and with Alex and the local authority, we've come up with a revised focus. So it was really just to seek support and help from the board, really. Going forward, our focus is very much around the BAME community, and in the first instance in the Black community, because those are the communities that are impacted the most with COVID and what's going on. So that's sort of our remit. All of our research and our surveys we do across the board to everyone. We've changed all of our back office systems, so we're now capturing ethnicity, so then we can pull out the element that's affecting the BAME community. So we will be doing targeted outreach to specific groups to seek views. Our focus for Q3 is very much around access to GP surgeries and to dental practices, which are two areas where we're hearing lots of concerns. Nothing new there for anybody, I'm sure. And within Q4 next year, our focus is highly likely to be around mental health. So it's very targeted. We're outreaching to mutual citizens, but secondly, what we're also doing as part of it focus for us is working with service providers to go in and almost act as a critical friend with what we called our 8 key lines of inquiry, but it's very much really just about trying to work with people, share intelligence to see where we can all work jointly to see where we can change and improve things. Very short, but thank you. Thank you for the opportunity.
Excellent. Thank you, Marie. And I do look forward to reading reports when they come through by email, and people can sign up for them quite easily. All come out by electronic mail. There's no hands up, so which is good. So if we note the report from Marie, that I haven't been notified of any other business. So even in these challenging times, we've only overrun by 11 minutes, which I think is really good. So thank you very much all for your time. And just hopefully we'll see you all again very soon.
Yeah.
Thank you very much, everyone. Thank you.
Bye bye, Javina.
Bye.
All the best.
Bye.
Thank you very much, Savina.
All the best. Bye.